Good morning and welcome to the April 27th Clinical Practice Video Update and Summary. My name is Olsen and I am the Clinical Manager in the Emergency Coordination Center for this week. Joining me today is Paramedic Specialist Darrel Hunsbedt and ECC Director Hawkes-Frost.
Hello, I'm Hawkes-Frost. I'm the Director this week in the Emergency Coordination Center. I was just going to give a couple of updates on the work that we're doing in the ECC this week and how we're supporting some of the projects underway to respond to the COVID emergency across British Columbia. Primarily our work in the ECC is moving from the first phases of a response to more of a long-term business as usual model to help respond to pockets of COVID patients and to help respond and support communities where they require it. Part of that is working with colleagues across healthcare and across the health authorities to ensure that the resources that they require are in place when they require it, and that patients are able to move around the province as they need to. A couple of other things I wanted to touch on. The first being really the fact that we have a population across the province who continue to suffer with their normal background, long-term medical problems, and all the other things that people choose to access our services for. It's important when people have anxieties and concerns about COVID that they not be afraid to seek help as and when they require it. And as advocates for our patients, we should be encouraging our patients to seek help when necessary. And as paramedics, it's part of our responsibility to ensure that we're giving our patients good quality information about their health. Lastly, it was just really around a problem that we see and have a lot of experience with in this province is resulting from the opiate crisis. We continue to see the effects and the harm caused by opiate use, and particularly in the downtown east side, in the lower mainland, and urban and rural areas around the province. Opiates continue to cause harm to communities. In the wake of some of the support being provided, we've noticed an increase in opiate and overdose-related calls, and it's important that we remain vigilant to the other public health emergency that's ongoing in British Columbia. So those are the updates from the ECC. I look forward to working with you all this week, and thanks as ever for your continued support in helping us respond to the COVID crisis. Thanks very much.
Hello, my name is Darrel Hunsbedt. I'm a paramedic specialist. Just want to give you guys an update. Please continue to call us for any clinical support you need. And just a reminder, in Siren, there is a tab under procedures to document whenever you make contact with us. Just to give you an update on ILI and secondary triage, pretty much been steady state throughout the weekend, so no major spikes. Thank you.
There are no new clinical practice updates for today, so this update will be short and sweet, but I will take this time to touch on a few pieces of information for you. There are some BCEHS learning videos that have been produced. You are likely watching this update on the BCEHS Clinical and Professional Practice YouTube channel. BCEHS Learning has been including several very important educational videos on the channel. The most recent update is an iGel troubleshooting video providing several tips on best practice and iGel use. Please tune in and review this important video. Furthermore, BCEHS Learning has developed a very concise doffing checklist that will be available in the BCEHS Handbook app for your use. And finally, there are some Siren PPE hot fixes. Crews are reminded that there's a new Siren hotfix to be installed on Wednesday, April 29th. One important part of this update will be the inclusion of a new section named Supplies Used PPE. This data will greatly assist in our ability to track potential exposures and monitor PPE burn rate. So that is all for today, and as always, we wish to thank you for tuning in, and thank you for all of your continued hard work and resilience, and just please be safe out there. Thank you.